Well, joining me now is Brian Dow, Deputy Chief Executive of the charity Rethink Mental Illness. Brian, thanks very much for being with us. We probably are familiar with the stats about the number of people who at some point in their life will have some mental illness they have to deal with. And it's a reminder, therefore, of lots of people in our workplaces, in and around us, who have the past or will do in the future. You're talking about a group of people who have effectively not been in the workplace, whether or not because of mental health, or about people who are also already at work and you're trying to keep in work.
Well, traditionally, if you had a severe mental illness, unfortunately what you tended to experience was a long wait for treatment, a kind of very testing road to get a diagnosis, and then ultimately the right kind of medication. That meant that, frankly, your illness had developed so much so that you were very unlikely to get into employment, and the whole prospect of that was, deeply kind of frightening. Hopefully, with the kind of improvements and the investment that's gone into the mental health system recently, actually all of that should happen quickly. So that's the basics. And in fact, the research shows that about 2/3 of people, even who have a severe mental illness, actually want to work, but have not really been given the right support, either to get into work, then of course once they're in that employment, to stay in that.
And that, I suppose, is the other element of this. You're not just helping the patient, the client, would be a better way to put it, but you're also actually having to work with employers to help them see beyond the illness.
Exactly right. I mean, people with a mental health problem are no different from anybody else. Well, what do you want? You want a job because you want that security. You want to be socially connected. Of course, a job brings an income with it, so that means you have money to spend and don't feel impoverished, and the isolation that comes with that. So helping both the person into the job, but also supporting the employer to understand what it's like to live with a mental health condition, often one that may fluctuate, so that the symptoms are not obvious to see perhaps, is, as you say, good for both the individual, the employer, and for the economy as a whole. So it's really fantastic news.
This is, I mean, we should stress this is a voluntary scheme, isn't it? There's no question of people being forced onto this. It's nothing to do with benefits or anything like that. It's purely about people who believe that they would like to work and want to find out more, and want to find out, obviously it's practical for them, and what might be available and what kind of support they can get.
That's right, and I think that's a really important point to make, because although around about 2/3 of people with a severe and enduring mental illness want to work, there's probably around about 1/3 of people who really can't, or who are not able at least to hold down full-time permanent work. Now, those people still might want to be able to volunteer or to do something valuable. So as long as there's support for people and understanding, and that the benefit system itself is giving the right kind of support to people, actually in theory, so as in time they can have some sort of graduated return back to some sort of gainful employment. So I think that distinction that you make is a really important one.
What about the confidence of clients you've worked with? What impact has work had on the people you've dealt with in terms of the things you were talking about social isolation and also self-confidence, particularly in recovery from mental illness, or while the mental illness is still ongoing?
Well, I think it's really important to remember that if you have a mental health condition, as I say, once you've got the basics in place, the things that affect your health, that will move your health up and down, if you like, are things like social connectedness, work. Decent housing is a really important factor. So actually, the difference it makes being in work, being part of a network, having friends that you can connect with, is enormous in terms of people's confidence, yes, of course, but also, as you indicate, the long-term recovery.
Just one final brief point, just picking up on the fact that this scheme is being expanded, 28 new areas in England. You've got to find the people who can provide the expertise and the knowledge.
Yeah.
Coming from the charity sector, how difficult is that going to be, do you think?
I think it will be a challenge. The single biggest difficulty, I think, for example, in delivering better mental health care in the health system has been the availability of a well-trained workforce. So you're likely to see a parallel here. But I think it's increasingly becoming an attractive career to move into, because people recognise that actually so many of us have a mental health problem, and being able to do something that isn't just transforming somebody's health, but perhaps transforming their entire life, hopefully makes it the kind of career that people will want to come into. I certainly hope so.
And if they are interested, what are the paths into it? I mean, it's something you don't have to kind of do higher level training for necessarily, or a medical qualification or anything like that.
Yeah, well, I think NHS England, who are of course investing in the scheme and you know, incredibly welcome as it is, are looking at a number of preferred employers who will no doubt go out in a recruitment programme. And I really hope that people get involved with it, because it's an opportunity to transform lives.
Brian Dowes, pleasure to speak to you. Thanks very much for coming in this lunchtime.